I hear so many moms say, I wanted to go natural, but I was high risk, so I couldn't. Or I wanted to have a home birth, but I had blank, so I had to go to the hospital. And while the underlying situation might have really been there, it might have been something that made you need to go to the hospital to be safer. It's not necessarily something that makes you have to give up everything that you wanted in your birth. If this sounds like you right now, or you find that it sounds like you in the future, understand that just because you have something going on that causes them to label you high risk doesn't mean that you have to give up and give in to all of the interventions. Today, we're going to talk about what that looks like and how to navigate it. Let's go. There are so many things that it seems are out there that can land you in that dreaded high risk category. You know what I think about that. If you've been listening to this podcast for any length of time, you know what I think about the whole low risk, high risk label. It's just a label. But it's the world we live in. And so it's also the world that we need to know how to navigate and deal with in case you're somewhere else, maybe where there's no access to more nuanced care, where somebody is actually going to think this through and not just call you high risk and put all the things on you, right? We need to figure out how to work our way through the system in a way that we don't give it all up. Okay. Because I know if you're listening to this podcast, there's probably a lot of natural things that you're really wanting for your pregnancy and for your birth. And that is wonderful. And I want you to know that just because you get a label of high risk on something doesn't mean that really most of it has to go out the window. There may be a few things you have to compromise on for your safety and for your baby's safety, but not everything. Let's say you have a pre-existing condition, something like a heart condition, maybe that you've had your whole life, or asthma or diabetes or a thyroid condition. Or maybe you've got a specific prenatal situation like preterm labor, multiple gestations, dates not matching up with your baby's size, how it's measuring, maybe some abnormal labs. There's all kinds of things out there that can end you up with this high risk label. And some of those things can change your birth location and plan. That's the truth. And usually, honestly, it's for your good because there's perhaps a higher level of monitoring that you need for some certain situation that exists. But I want you to understand that it doesn't automatically mean you have to throw that proverbial baby out with the bathwater. Remember, no is still an answer. Remember that they are the medical professionals. They get to assess the situation, make recommendations, and make those recommendations based on their knowledge and their experience and their opinions, based on what they've seen in their career. That's all good. That's needed. But you are the one who decides. You are going to need to be reasonable and you're going to need to be balanced, yes. And you want to be reasonable and balanced because you don't want to make a decision that's unsafe, but you also don't want to be fear-mongered out of having the type of birth that you want in any way possible. You don't have to give in to everything. Let me give you an example. Let's say your blood pressure is high and you're either at term or close to term, and they decide they want to induce you. They are worried about the dangers of preeclampsia, which is understandable. I'm not going to go through whether you have preeclampsia or how to diagnose all that here. We're just going to go with this being a situation in case you encounter it. So you are being encouraged to have an induction because of your blood pressure. You don't want to be induced because you want to labor naturally, and you know that induction makes it more difficult to do that, if not impossible. Now, you could agree to go in, and you could maybe ask them to do a slow induction instead of just all out throwing everything at you to try to really, really get you into labor. You could ask for them to not increase the rates of Pitocin as fast as they might usually do it so that it is more closely mimicking what your body would do on its own. You might ask, even instead of doing Pitocin, if they would first let you start with breast stimulation with a pump or yourself. Usually a pump is more effective. Instead of the medications, maybe even while at the hospital, because that way they're able to see you, monitor you, make sure that your pressure is not getting too high, while also allowing your body to have the chance to try to go into labor on its own. You might even ask if you could do either of those for a period of time and then come off of doing those things and go for a walk to see if maybe your body will pick up on the signal you're giving it and go on into labor without additional medications or without additional pumping. High blood pressure does tend to be an indication where they really want to get things going fast because, like I said, preeclampsia can be dangerous. But you can also ask them something like, hey, could I have a couple of days to really work on my blood pressure with dietary changes? Now, understand they're going to balk at this because they don't really think that it's possible. But you could just ask them, can I have a couple of days to monitor it? I'm going to really work on my diet and see if anything happens. And you can tell them, I'm going to monitor my blood pressure regularly. If anything gets out of whack, I'll let you know. But you want to give yourself a little cushion to go home and read and absorb the website for the brewer diet, which I'm going to put down below, and then just dive into it and do all of it because that has been known to reverse preeclampsia for some people. And so that'll give your body a good chance to reverse the process while you're given that little cushion. Now, again, they're not going to like that. And if your symptoms and your blood pressure are too high and too severe, that might not be a good option. But if we're in the early stages, this is something you can work on. And while on the topic, let me just say that you should check out the brewer diet long before you have blood pressure issues to try to prevent them. So go check out that link that I'm going to put in the description below so that you can see what I'm talking about. You might also ask them, can you try some natural induction methods that maybe your midwife can suggest to you to try to get labor nudged into working on its own, like I said before. A lot of times when you have things going on that are outside of normal, your body kind of senses and knows that, hey, yeah, it's time to go ahead and have this baby. And so sometimes these things will nudge you in that direction and get things going. There are all kinds of things that are possible, and these are just a few ideas. I'm just trying to get you to think outside the box so that maybe you don't have to throw out your entire birth plan. Let me give you another example. Let's say it's been decided for whatever reason that a C-section is the best option to keep you and your baby safe. Now, there's very few times that that's true, but there are some times that it is true. So let's say we've made this decision, but you still really want that golden hour of skin-to-skin contact with your baby and to be able to breastfeed in that first hour, and you really, really want delayed cord clamping. That's great. You should be able to get those things in most cases. You could request that the drape, which when you have a C-section, they put a drape up so that you can't see what's going on down there. And we won't discuss whether they should be. It's just the way it is. Some places they actually have them now that have little windows in them, but not all places have that. But you can request that that drape be moved down further away from your face, that your gown be moved down, and that your baby be put directly against your skin with their skin, not wrapped up in a swaddle, but with their skin. And then have your husband help to keep the baby secure to make sure the baby doesn't fall. You can even request delayed cord clamping. Now, they're probably going to say that they're worried if they do that, that your infection risk is going to go up. That may be valid, but remember, there's a lot of surgeries that last a whole lot longer than a C-section. I mean, a C-section from cut time to being completely done and sewn up is usually somewhere around 30 minutes. There's a lot of surgeries that are open for a lot longer than that. So giving you 30 seconds, a minute, minute and a half, 2 minutes to give that placenta the time to pump that baby's blood back to the baby, it's really not going to increase your risk that much. So you can ask them if they would allow that. Again, they're not going to love it. Most doctors are going to really push back on that. But if you're the one taking on the risk of the infection, then it ought to be something they would entertain. Beyond that, they're probably going to be giving you antibiotics anyway. So your increase or the infection risk is going to be mitigated by the fact that they're giving you antibiotics regardless. On that topic, ask them not to give the antibiotics until the cord is cut so that only you get the antibiotics and not your baby. That way that the baby's not starting out having its microbiome being impacted by those antibiotics. Again, another thing that you can ask is that the baby stay with you and not be taken to the nursery. Again, they are not going to like that. But remember, it is your baby, not theirs. They're not going to like it because they have protocols and they have things that they've got to get done and checks and boxes that they have to get. I was recently in a C-section where they needed to take the baby to the warmer to do some suction, and that was valid. They really just weren't set up to do pretty much any of the things I've mentioned here. So as they take the baby over there, I understand that first step of wanting to make sure that the baby doesn't suck the meconium into their lungs. That's all fine. In this case, for those of you who are thinking, oh, but all meconium doesn't need to be suctioned, this one did. It was the worst meconium situation I've ever seen. So that's all fine and good. But then after that was all done, they continued wiping the baby off, measuring the baby, weighing the baby, doing all of the things, all of them. And I wasn't happy with how long they were keeping that baby over there. They were doing measurements, like I said, they were doing everything. So I asked them why they couldn't wait and do that stuff later. They told me they could not admit the baby into their computer system until all those things were done, because I guess they have to enter them in as they go. So think about that. To that, if I was the mama, I would have said something like, oh, well, your computer can wait. This time with my baby can't be replaced. But of course, this was, a little bit of a difficult situation. We didn't really know this was all going to be happening. In the moment, it's hard to advocate for that. So this is why these are good things to think about and discuss before the C-section is done when it's not emergent. These moments with your baby cannot wait, and the nurses can. Maybe the baby just won't be in the system for a while. And again, they're not going to like that. But these are moments that cannot be replaced. And so sometimes you're going to have to advocate for yourself. There are just so many things that I could talk about here that can be put on you as a label. And I can't go through all of them. But that's okay, because at the end of the day, it doesn't really matter what your label is. It matters that you advocate for yourself and you still hold on to every bit of your birth plan and wishes that you can. Having something outside of the normal doesn't change the fact that God made you to give birth, and that this is still a natural process. Now, you may have things that are happening that aren't normal or aren't natural, but that doesn't mean you have to give it all up. This is when having a doula is a really, really good idea, because a doula can help you with all of these things a whole lot. They can help you navigate the system, and they can help you advocate for yourself, because they're going to be there with you as a support before labor and during labor, in a way that even if you're having a home birth or planning a home birth that ends up moving to the hospital, your midwife is still supporting you, but she may not be there every moment the way that a doula can be. So this is a really, really good reason to have a doula working with you. And one last thing to consider, even if you need to see a physician for part of your care, still request if it's possible for you to get co-care with a midwife, so that only the situation that is actually high risk can be addressed by the physician, while the rest of the pregnancy can be treated as normal as possible by the midwife. And you're not just treated like one big label, you're treated as a woman who is giving birth, which is how you should be treated. That's going through a woman who's going through a natural process that's got a few extra issues to deal with maybe, but it's still a beautiful natural process, and you deserve to be respected in that process and not just be treated like an accident that's waiting to happen. If you want to learn more about how to navigate this system, just remember that my course covers everything that we've talked about here, everything under the sun that you need to know to have a natural, God-led pregnancy, birth, and postpartum. So go on and hop over and join us. Go to go.yourbirthgodsway.com/CEC and join us. Our next live question and answer session is actually this week on Thursday. So if you get signed up before then, you'll get to join me. Again, that's go.yourbirthgodsway.com/CEC. I would love to see you there for the next class. Like I said, we cover everything that you need to know. And so you can know how to navigate these situations even better, even more thoroughly. You'll understand the interventions and what their purposes are, so that you can know if you really need them or not for yourself. It's a great, thorough, just complete course that covers everything under the sun. So go get signed up for that. I hope to see you there, and I hope to see you back here next week for another episode.